Good afternoon. My name is Pierre Vigilance. I'm the Director of the District of Columbia Department of Health, and I appreciate the opportunity to provide this testimony before you this afternoon. Chairman Catania, Chairman Mendelson, Councilmember Bowser, and other distinguished members, thank you for the opportunity to provide testimony on Bill 18622, Legalization of Marijuana for Medical Treatment Initiative Amendment Act of 2010. Medical marijuana, otherwise known as medical cannabis, has long been used as a herbal therapy. While its medicinal qualities and utility have been questioned, there is documented evidence that demonstrates the drug's capacity to reduce nausea and vomiting, stimulate hunger in chemotherapy and AIDS patients, and in general, to relieve pain. There may be other uses for the drug that we would have to examine as we define the scope of its use here in the district. In 1998, voters in the District of Columbia approved a medical marijuana initiative by 69%, but Congress placed a ban on the results. We look forward to working with the Committee on Health, medical marijuana experts, and medical providers as we attempt to best define and develop current legislation for the use of this substance here in the district. We also appreciate the Council's acting swiftly to ensure that a clear and comprehensive statute is put in place that will implement the referendum both responsibly and in accordance with the will of district voters. The administration is still closely examining the proposed legislation and all of the issues that will need to be considered before final passage. The testimony offers just a few considerations that will have to be taken into account during that process, and we look forward to working closely with the Council on the legislation's final form. With respect to medical need, from a medical perspective, a program in the district will have to draw on best practices from around the nation to ensure the safe and appropriate patient qualification, distribution, and use of medical marijuana. According to the Drug Policy Alliance Network, laws that effectively remove state-level criminal penalties for growing and or possessing medical marijuana are in place in Alaska, California, Colorado, Hawaii, Maine, Michigan, Montana, Nevada, New Mexico, Oregon, Rhode Island, Vermont, and Washington. There is some variation in the conditions that various states authorize the use of medical marijuana as treatment. We support the approach of Bill 18622, which would leave this issue to be determined in regulations. As a frame of reference, approved conditions in California include AIDS, anorexia, arthritis, cachexia or wasting associated with appetite loss, cancer, chronic pain, glaucoma, migraines, persistent muscle spasms, including spasms associated with multiple sclerosis, seizures, including seizures associated with epilepsy, and severe nausea. In New Jersey, approved conditions include seizure disorders, including epilepsy, intractable musculoskeletal spasticity, glaucoma, severe or chronic pain, severe nausea or vomiting, cachexia or wasting syndrome resulting from HIV/AIDS or cancer, ALS, which is amyotrophic lateral sclerosis, otherwise known as Lou Gehrig's disease, multiple sclerosis, terminal cancer, muscular dystrophy, inflammatory bowel disease, including Crohn's disease, and terminal illness if the physician has determined a prognosis of less than 12 months of life, or any other medical condition or its treatment that is approved by the Department of Health and Senior Services. With respect to dispensing, the bill provides that no medical doctor or physician or pharmacist shall be prosecuted for dispensing or distributing marijuana for medical purposes when such action occurs in the course of his or her professional practice. Currently, medical marijuana can only be dispensed for cancer and glaucoma, and as you know, federal law prohibits physicians from writing prescriptions for illegal drugs, including marijuana. However, the drug will be dispensed, and how the drug will be dispensed, and by whom, as well as the responsibilities of medical providers to their patients during the patient's certification and dispensing process are significant issues that will have to be addressed by the statute and regulations. Additionally, a decision has to be made about the sites at which the drug will be available and whether we choose to restrict dispensing to an over-the-counter model or allow for mail order as we do for other drugs. Consultation with the medical practice community, both traditional and non-traditional, will be necessary to create an appropriate network of medical marijuana dispensing professionals. There is a significant need to ensure safe and controlled practices for this substance so that those truly in medical need can obtain relief while preventing abuse of the system by those seeking to gain access to marijuana for non-medical purposes. With respect to cultivation, in addition to the medical issues raised by the dispensing of medical marijuana, there are issues that need to be addressed regarding its cultivation and distribution. The district will have the appropriate regulatory agencies ensure that the drug is cultivated in locations that protect the health and safety of all of our residents. With respect to enforcement, the legislation under consideration must be narrowly tailored so that they will not allow for law enforcement efforts and the safety and security of our neighborhoods to be compromised. Bill 18622 purports to provide an exemption for licensed dispensaries, patients, and their primary caregivers for marijuana that is prescribed by the patient's primary physician for treatment of a serious medical condition. Otherwise, the distribution and possession of marijuana will continue to be illegal under District of Columbia law, and prosecution of those who do not fit into these limited categories will continue. The Metropolitan Police Department will continue to strictly enforce laws against illegal possession or use of marijuana. Enforcement is an important issue for the district and our communities to discuss. In particular, we need to send a clear message to children and young adults about the long-term health effects of the use of this drug. Some of the enforcement issues that need to be addressed include restrictions on the locations where medical marijuana may be used, how it may be transported, the quantity one may possess at a given time, and reconciling patient rights with public safety concerns as it relates to occupations where the employers currently prohibit the presence of any controlled substance in the workplace. We trust that the final version of Bill 18622 and implementing regulations will permit the appropriate balance between the use of medical marijuana for limited palliative purposes and continued vigorous enforcement of this city's drug laws. We recognize the complex nature of dispensing a substance that is illegal for recreational use and wish to ensure that all our partners in this effort work hard to keep the drug available only to those who need it for the medical purposes we define. We appreciate the opportunity to comment on this legislation and look forward to assisting in a smooth and effective transition into this practice. Thank you.
Thank you very much, Dr. Vigilance.